When Hurricane Helene made landfall as a Category 4 storm in Florida in September 2024, it quickly became clear this would be a disaster of historic proportions. As Helene tracked inland, its effects rippled far beyond the coast, hitting the Appalachian regions of North Carolina and Tennessee with record-setting rainfall and widespread flooding. In North Carolina alone, at least 107 people lost their lives, and the state suffered more than $59.6 billion in damages, the highest disaster costs in its history. But as the floodwaters receded, another story emerged. The story of how Helene exposed and deepened existing social and economic inequities, especially in rural and marginalized communities across Appalachia.
Let's start with education. The storm forced school closures across the region, but the path to reopening was anything but equal. In Asheville, some schools managed to resume classes or switch to virtual learning within days. In contrast, students in rural districts like Boone and Banner Elk faced weeks or even months of disruption. Damaged buildings, impassable roads, and a lack of reliable internet made remote learning nearly impossible for many. This uneven recovery widened pre-existing educational gaps between urban and rural districts.
Socioeconomic status played a key role in determining how families weathered the storm and its aftermath. In the hardest-hit Appalachian areas, fewer than 1% of homes had flood insurance. Most homeowners discovered too late that the National Flood Insurance Program, designed mainly for coastal flooding, did not cover their inland communities. The result? Low-income and BIPOC families were more likely to experience housing loss, displacement, and long-term economic hardship. Many faced denied insurance claims due to technicalities or zoning issues, leaving them to rely on limited government aid or local support.
Appalachian communities are no strangers to hardship. The region's rural isolation and tradition of mutual aid shaped both the challenges and the resilience of local residents. While the lack of infrastructure made organized recovery difficult, especially in remote mountain towns, neighbors often stepped up to fill the gaps, providing food, shelter, and emotional support.
Helene also exposed major flaws in the systems meant to protect people from disaster. While emergency management plans and federal aid programs are designed to provide support in moments of crisis, the reality is that these systems often fall short when faced with large-scale, unexpected events.
Most property owners in affected Appalachian regions were underinsured or had no flood coverage at all. While insured wind and flood losses from Helene were estimated at $10.5 to $17.5 billion, total damages, including uninsured losses, were more than 3 times this cost. Many families saw their claims denied due to zoning loopholes or bureaucratic delays, highlighting the inadequacy of current insurance frameworks for rural and low-income communities.
Infrastructure failures made recovery even harder. Helene destroyed or damaged hundreds of roads and bridges, leaving 734 roads in North Carolina impassable days after the storm. Nearly 6 million people lost power across 10 states, and water and sewage systems were severely compromised. These failures isolated vulnerable populations, including elderly and people with disabilities, from essential services and delayed the arrival of help.
Government aid was also uneven. Federal and state assistance often arrived more slowly in rural and lower-income areas compared to wealthier urban regions. This delay deepened recovery disparities and left many communities feeling neglected. The story of Helene is not unique. Around the world, climate change is making storms more intense and frequent. The burden of these disasters falls heaviest on those least equipped to recover. Rural Appalachia's struggles echo those of marginalized communities in other countries, where underinsurance, weak infrastructure, and slow government response are common threads.
While many communities across the Southeast were left reeling in the wake of Hurricane Helene, government aid often fell short of meeting the urgent needs of those most affected. Federal disaster relief systems, strained by the increasing frequency and scale of disasters, struggled to deliver promised assistance, and congressional gridlock further delayed critical funding for long-term recovery. In response to these challenges, local organizations and national NGOs played a critical role in the aftermath. Operation Airdrop delivered emergency supplies to remote mountain communities, while Wine to Water provided clean water to areas cut off by landslides. These efforts, often coordinated by local leaders and volunteers, demonstrated the power and necessity of community-led disaster response.
To better understand the vital role NGOs played in the hurricane recovery efforts, we connected with Wine to Water, an organization at the front of the response. Their team was instrumental in providing clean water, resources, and long-term support to those affected, and were crucial in assisting North Carolina's underserved communities with disaster relief. When Hurricane Helene swept through western North Carolina, the devastation was not only unprecedented, it was deeply personal. For Wine to Water, a global clean water nonprofit rooted in international humanitarian response, this crisis struck in its own backyard. What followed was unanticipated, intensive, and deeply transformative experience that reshaped how Wine to Water approaches domestic disaster response. Disaster response typically unfolds in 3 overlapping phases: response, recovery, and resilience. Response typically lasts from 3 weeks to 3 months and is marked by urgency, disorder, and an immediate need to stabilize daily life. Recovery spans roughly 6 to 12 months and focuses on restoring routines and infrastructure. Resilience, the final phase, looks beyond the current crisis to build stronger systems that can better withstand future shocks. While these definitions provide a framework, the reality is far more complex, especially when local infrastructure fails and water access becomes the most pressing challenge. Wine to Water's initial response focused on getting clean water to the most marginalized populations. Within days, the team began bottled water distribution, prioritizing vulnerable neighborhoods. They partnered with local churches and grant centers, distributing not just water, but hygiene and sanitation supplies. But as donations began to flood in, the team pivoted toward more sustainable solutions. They deployed aquablock units, high-capacity water treatment systems with multiple spigots throughout the city. These enabled residents to refill reusable containers, reducing reliance on single-use bottles and mitigating environmental waste. To further address the plastic surge, Wine to Water worked with Curbside Management, Asheville's local recycling company, creating central collection points to manage the influx. By mid-November, running water was restored, but questions remained around potability. That marked the transition to the recovery phase, where the team worked to ensure that quality, identify contamination pockets, and support long-term water testing. Wine to Water began using GIS mapping and neighborhood-level assessments to identify systemic water vulnerabilities. Their goal, to partner with communities, health departments, and local governments to develop robust localized WASH programs. One of the most innovative aspects of the response was its adaptability. Wine to Water had never executed a large-scale domestic disaster response before. They rapidly created a new office, hired local staff, and began building an agile structure that could integrate disaster response with municipal systems, a model borrowed from their international work, but tailored to the complexities of U.S. infrastructure and policy. Prior to Helene, Wine to Water's U.S.-based work had been relatively limited, focused mostly on indigenous communities, but this experience has redefined their domestic mission. The organization is now actively exploring clean water access for residents in generational poverty across western North Carolina, including those who live in homes without access to wells or city water. They're looking at solutions such as rainwater harvesting systems while ensuring that they don't unintentionally put residents at risk of housing insecurity or eviction. Wine to Water's mission to support life and dignity through clean water now extends not only globally but also locally, with new urgency and perspective. Hurricane Helene challenged Wine to Water in ways few could have anticipated. It forced the organization to adapt, expand, and reimagine its role within the United States. Through tireless commitment, innovation, and a deeply rooted culture of service, Wine to Water not only responded to a crisis, it helped redefine what resilience looks like in the context of domestic water insecurity. In doing so, Wine to Water reminds us that the work of water, like the work of justice, is never finished. It is ongoing, evolving, and deeply human. Clearly, government assistance didn't cut it for the people of North Carolina, nor will it fix itself going forward, without substantial policy change. We believe that those in need of suffering in the wake of natural disaster shouldn't be forced to rely on the goodwill of others to fulfill their basic needs.
For future resilience, we think several policy changes are essential, which include expanding and reforming insurance coverage to include inland and low-income communities, investing in resilient infrastructure, especially roads, bridges, and utilities tailored to rural and mountainous regions, ensuring equitable and timely distribution of disaster aid with a focus on the most vulnerable populations, and finally, incorporating community voices into disaster planning and recovery efforts.
Hurricane Helene's legacy is more than a record of destruction. It's a case study in how disasters can magnify existing social and economic inequities, especially for marginalized and rural communities. Addressing these challenges requires systemic policy changes, targeted investment, and a commitment to equity and disaster resilience. To move beyond Helene means to build systems that protect everyone, not just the privileged few. By learning from both the failures and successes of Helene's aftermath, we can work toward a more just and resilient society, one prepared not just to survive the next storm, but to recover together.